So our next award will be presented by Amy Liebman, who's going to tell us about our award winner for the Lorin Kerr Award. So Amy.
Well, congratulations to all the awardees. It's really fun to be here, and nothing brings me greater pleasure to introduce La Doctora Marysel Pagán Santana. I met Marysel here at APHA when she was a student attending through a KEO scholarship. So if you want to put that link to that KEO scholarship donation, go ahead, Kathy Kirkland. And we chatted at length about the worker protection standard and the challenges and the needs for Puerto Rican farm workers. And from that first encounter, it was blatantly obvious to me that Marysel was not only incredibly smart, but she had this deep passion for and commitment to worker health and safety. As a trained industrial hygienist and doctor of public health, she is systematic and scientific in her work, and she brings that knowledge to the community and to the workers in an easily understood way, always with the goal of protecting the most vulnerable. As a Puerto Marysel is consistently confronted both personally and professionally with one public health crisis after the other. These include the brutal economic policies of the US mainland, our climate crisis and its resulting natural disasters such as hurricanes Irma and Maria, and it includes the earthquakes and now COVID-19. At each turn, Marysel is fighting the good fight. She was president of her student body following the hurricanes. She was president of the student body during the hurricanes. And following them, she worked so hard to ensure that food and shelter and basic provisions were given to students in the surrounding communities. She took that experience and then spearheaded an island-wide community mobilization program to help the most vulnerable prepare and respond to future disasters. And during COVID-19, she has been this amazing leader on the island, helping to ensure workers from teachers to custodial staff to farm workers are protected. And she spent countless hours, and I mean countless hours, providing training and technical assistance to health department staff to foster accurate documentation of work-related outbreaks. And that outcome is now that Puerto Rico has data that links workplace and COVID-19 together, contradicting that status quo that is so quick to blame individual circumstances as the cause of infection. Marysel, your wit, your intellect, and your deep knowledge of Puerto Rico from sports. She'll talk to anyone about the time that the US lost to Puerto Rico in basketball. And your endless commitment to workers never cease to amaze anyone around you. Congratulations, Marysel. You truly embody the Lorin Kerr Award.
Thank you, Amy. I'm really excited to be here and honored to receive this award. I first want to thank the American Public Health Association and the Occupational Health and Safety section. The welcoming environment they create for young professionals is unique. Since joining APHA during the annual meeting in New Orleans in 2014, I have seen the energy and enthusiasm with which new and future generations of public health professionals are received and included in advocacy efforts for public health. This space experience and networks were an essential part of my development and what led to my integration into the migrant clinician networks. Without a doubt, the perfect beginning of a professional path that I have traveled and I wish to continue. Before talking more about that, I would like to share how I got here. Much of my energy and passion for worker-related advocacy results from a childhood filled with rallies and protests for workers' rights in Puerto Rico. My parents, both union workers in the public sector, a teacher and a data analyst, taught my sisters and me to fight for labor justice for vulnerable and disadvantaged populations for what was fair. At that time, I did not quite understand the concept of labor rights, nor did I know how a person could get sick at work. I didn't understand it, but I saw it through my parents in stress, fatigue, illness, and back pain. I know now that what was unpaid work, unsuitable workplace, infectious disease in office with no ventilation, and economic problems. That was what I was seeing. From having workloads and inappropriate equipment. As time went by, I saw it as a norm. We fight and maybe someone will help us. I didn't know that there were people dedicated to supporting workers and finding solutions to these problems. I didn't know that I wanted to work with public health and workers' health and safety. The first critical moment was an environmental emergency management class whose focus was the protection of first responders. The aha moment of discovering that I could make a profession out of my interest in workers' health came when I asked the teacher what was the job of the person that gave out the hard hats to the workers. I wanted to be that person. The rest was a process of completing courses, applying to graduate schools, hoping that this opportunity will not force me to leave my country. I managed to enter the University of Puerto Rico and its industrial hygiene program. I was met by mentors and had the opportunities to impact communities and finish both my master's and doctoral degree here. The university returned me to where I first discovered occupational health, the schools on healthy work environments. Through a Susan Harwood grant, I had the opportunity to train principals, teachers, and cafeteria work employees. Each training experience was a reminder that the school's environments were not appropriate for these workers. I remember a conversation with a cafeteria employee in which he told me about how heavy the instruments they were using were and the fear that they had that they would fall in their feet at some point. This was why they were continually in awkward postures while working, resulting in pain, and the lack of appropriate tools or even inadequate shoes was causing them pain. The opportunities that the University of Puerto Rico gave me in the training were not limited to academic experience in that classroom, but were more than that. I consider it a core part of why I continue learning to advocate for the vulnerable populations and work with the communities. In the university, I was able to see the different aspects of social inequalities, the role of health professionals, and establish links with other health professionals that quickly turned out to be highly beneficial. During my career and my experience as president of the student body and member of the university governing board, I had the opportunity to join other advocacy processes and fight for what I consider fair. The networks that I built during my studies were essential in advocating for protecting essential workers, especially teachers, during this public health emergency, the COVID-19. Now, young professionals like me, teachers and students, join from different fronts to respond to the public health crisis and the workers' need. One of the collaboration spaces that I was able to join was a group called La Mesa Social, and an organization that puts together various groups in defense of the workers and vulnerable population. Other groups that joined our effort was the school surveillance system and the municipal system of investigation of cases and tracking contacts. Both groups created a significant front in the defense of the protection of workers in Puerto Rico. This collaboration allowed me to offer my support in the organization and advocacy for healthy schools, a role I continue to practice in collaborations with Teachers Union. Getting involved with these groups was the silver lining of a public health emergency partnership that opened the channels of cooperation that we have been missing. One opportunity that the COVID-19 emergency has fostered is linking my knowledge and experience with struggles of these groups and communities. The satisfaction of being able to provide practical solutions that promote public health and workers' health is unique. This is true for other populations that I also collaborate with, such as agricultural workers in Puerto Rico. These workers also suffer from inequities and injustice in their places of employment and fight daily to contribute to the country's food security without guarantees and protections that allow them to be healthy. I cannot emphasize enough the intrinsic role of that education has in these efforts. Especially today, the spaces that provide for the development of professionals like me are limited. Young professionals in Puerto Rico have no alternative but to migrate to get fair employment, and essential workers see their rights and financial security disappear. The intersectional and political issues with the environmental stresses have been a significant setback for students, teachers, young professionals, and disadvantaged populations in Puerto Rico. Through teachers' unions and the university, public education has been the consistent front in the fight for labor, justice, and decent and safe workfields. As a social determinant of health, it's evident that the direct implication of educational impairment is a population with more significant, will cause a population with more significant difficulties and inequities in health. I cannot stand in front of you virtually without asking you to support workers, teachers, and professionals in training in the fight for adequate financing to continue providing accessible and quality education in Puerto Rico. Without them, I would not have been able to accomplish the achievement that we're celebrating this afternoon. I would also like to make this an opportunity to thank those who in one way or another support recovery efforts and advocacy for workers and communities in Puerto Rico, such as the Migrant Creations Network. There is no better workplace than one whose source of energy to continue the fight is vocation. MCN has joined the fight for labor justice and safe workplaces in Puerto Rico and provided the space for young professionals like me and talented people in the island to remain in it and join its organizational mission, allowing us to contribute from the Caribbean to the US and support local efforts. Finally, I want to say a last thank you and I apologize for those who may have difficulty with Spanish. Agradezco a mis padres por fomentarme el sentido de justicia por los derechos y empatía por los más vulnerables. A mis hermanas, mi pareja y mis amistades que siempre han ha sido una fuente de ánimo, apoyo y consuelo y acompañamiento. A mis sobrinos, en especial a Adrián y Nicole, que son un recordatorio constante de por qué no debemos dejar de luchar y abogar por mejores condiciones de vida. Thank you.
Wonderful. Thank you so much, Marysel.